Hi everyone, and welcome to The Smile Project, the podcast of the School of Dentistry, IMU. Thank you for joining us today. This section of The Smile Project is called The Dental Bites. Tune in to this section for bite-sized learning on the go. So let's begin.
Hi everyone, we have Dr. Siddharth today with us. He's an oral maxillofacial surgeon with IMU. He's here today with an interesting topic for all of us.
Thank you, Dr. Suren, for the introduction. So you might be wondering when to remove your wisdom teeth. And then we want to learn about what are the basic steps which is required, which will be done by a dentist or oral surgeon in removing your wisdom teeth. Okay, so moving on to the first aspect of the podcast today is, so when do you remove the wisdom teeth? It's like when you have pain, when you have repeated infection in the gums around the last tooth, the wisdom tooth, or at times something called a cyst might be formed in case of long lasting, impacted. When you say impacted, is in the tooth is stuck inside the bone. So in case of cysts, in case of tumors, like you have kind of cancers related to that particular area or the jaw, and then causes damage to the next tooth, the tooth in front. And gum diseases, we call them periodontal diseases, where there is inflammation of the gums or infection of the gums. And finally, your tooth decay. So these are the criteria where you are required to remove your wisdom teeth. Okay, let's moving on to the steps. So going on to the steps, what your dentist or oral surgeon would be doing to remove your wisdom teeth. Okay, so before you go in for the surgery, we call it the minor oral surgery because the teeth which is not in place and not in position because it's kind of inclined or it's kind of malposed, so which has to be removed surgically. When you talk about surgery, it's a minor surgery where it takes about 40 minutes to 1 hour, even more, depending on the complexity of the impaction or your teeth being stuck inside the bone. So initially, the dentist or the oral surgeon will order for an X-ray. Preferably a 3D X-ray would be fine to know the relationship of the roots of the third molar of your wisdom teeth in relation to the nerves, below the root. So ideally a 3D X-ray is advisable. So once you take a 3D CT, we call it as a cone beam CT, then the dentist or oral surgeon will plan to remove the wisdom teeth by using few instruments and also a surgical drill. So depending on the complexity of the tooth, like how it is positioned in your jaw, so there are a few procedures which can be done, types of procedures which can be done to remove your teeth. Either the teeth can be removed on the whole or it can be removed in pieces, which is absolutely fine. It is in the discretion of the oral surgeon or the dentist. So first thing is to give a numbing agent, a numbing injection, so which will numb not the entire body but then the part of your jaw, the lower jaw or the upper jaw or wherever your dentist or oral surgeon is going to work on. So the numbing injection is injected, so it'll take about 3 minutes to 5 minutes depending on the individual to get the complete numbness on that particular area. And then your oral surgeon or a dentist will start the procedure. So initially there'll be a small cut to the gums where you have to expose the teeth, which is to be extracted or removed. Okay, so following the small cut, there will be a small elevation of your gingiva, the gums, and then the tooth is exposed, and then the dentist or oral surgeon might use a surgical drill, especially used for dental purposes, will be used to remove the bone because the tooth is stuck inside the bone and the bone has to be trimmed off to remove or to expose the tooth. So which will cause a bit of noisy discomfort, but then if you're okay listening to your favorite podcasts or songs, then you might do so. So once that's done, so your teeth is completely exposed and the dentist might choose to remove on the whole, or he might section the tooth into a few pieces and remove it completely. So that's so once the tooth is completely removed, your dentist uses saline or a distilled water to clean up the area and then see if there are any root debris or root tips or broken teeth fragments left inside the socket, the empty socket where the tooth was before. And then once it's been cleaned, there will be a bit of filing to be done to remove the sharp edges of the bones, and then your gums will be sutured or stitched back using special surgical stitches. Okay, usually there are types of surgical stitches which is resorbable and non resorbable, meaning it has to be removed. It doesn't have to be removed, it will be dissolving in due course of time. And you're done with your surgical procedure, and then you follow the instructions which has been given to you by the dentist or oral surgeon, and then you recover in about 4 to 5 days after the surgery.